Biochemically, potassium softens our blood vessels. It increases NO, so it's really like a softener in the endothel, while salt stiffens them. You can prove that really in the lab with endothel cells. So look at that dramatic results. Giving people with hypertension potassium supplements lowers stroke risk by 64%. There are many studies showing that. What is the problem? A lot of the people with hypertension, they get medication that lowers potassium, they get cardiac arrhythmia, and. So just by getting depleted in potassium, they increase tremendously the risk of one of the major killers we have nowadays. Potassium is the most underrated and important mineral in the diet. If you look at long-term mortality in large meta-analysis, you see that per 1 gram sodium, mortality goes up 20%, and per 1 gram potassium, it goes down 20%. And here, you see, I'm not talking about fruits and vegetables, I'm just talking about mere supplements. So a lot of the benefits of eating a lot of fruit or vegetables is really the potassium, or not some inexplainable thing. So what happens? We eat too little potassium, too much salt. The problem in our blood is not much visible, but it happens in the cell where we accumulate potassium and deplete, and we accumulate sodium, deplete in potassium. That's why in order to figure it out, you really have to make a whole blood analysis which shows the intracellular status. At the same time, the other cations, calcium increases, magnesium goes down. That has a big influence on blood pressure and muscle tone, and this has a big influence on membrane potential. Membrane potential is very important for thousands of things, but of course also cardiac arrhythmia, which is like people, if they die of a heart attack, they usually die of the arrhythmia coming from the heart attack. And the disbalance of potassium-magnesium depletion is very essential in insulin resistance. So you have a direct link to really the main problems we have nowadays. And we've seen time and time again that if people start taking our alkaline products and are in early stages of diabetes, they do a lot better and it normalizes even. Same with hypertension. So it's not a theory, really practically see that in giving the stuff to people. So next to the sodium-potassium thing, what happened is that the base or alkali to chloride ratio also went topsy-turvy. We used to eat a lot of things that turn into bases or alkali, which is like citrate, malate. All that metabolizes in an alkaline form and is excreted in that way and protects the kidneys. Now we are very rich in chloride and other acidic forming molecules, which are chloride, phosphate, sulfate. We come into more detail to that. It's another major change in our diet, and they go very much together. So this acidosis promotes inflammatory processes, bone loss, muscle loss, all the things we see in old age when the kidney starts to go down. It increases the risk of stroke and heart attack a lot. We will prove that in detail how the mechanisms are in the second half. So in order to correct it, you do need to get enough calcium, magnesium, and especially potassium. And in an alkaline form, not in an acidic form. So potassium chloride is junk. It's only half good. Just like sodium chloride is double bad, chloride is the acidic part, and it's one of the big problems in hypertension. It's not only the sodium, we come to that. Well, yeah, in order to have that old age, it's good to start early. Vitamin K2 is another one, vitamin D, and the other ones. And of course, exercise. And what is often forgotten is, adapt your bathroom. It's really important that you don't slip in the shower. All right. We talked about acid base, salt. Our grandparents ate a lot of salt and they didn't have the problems. Oh, you hear these arguments a lot. It's true. as long as you can excrete the salt or sweat it out, it's not much harm. Our problem is that in our lifestyle, we increase the stress hormone cortisol a lot, and then salt accumulates, and magnesium, potassium, and calcium gets lost in the urine. So that's how the lady looks normal, and that's under stress with cortisol. You blew up, you get a little moon face, but it can be quite slight. You need to know the person to see that. Another very interesting factor is that how stress makes you fat. The cortisol in the blood is usually not even dramatically changed, but it's in your fat cells. And there it converts cortisone to cortisol, and the problem is really directly in your abdominal fat cells, where edema formation is, the metabolism is inhibited, and you accumulate more and more fat, and insulin resistance and so on is built up. So cortisol has a lot of traumatic side effects, and to reduce stress in our life is really important. Yeah, there are other problems with it, well known. The stress nowadays is different from previous times. We have cold stress, and the effect is different. We come to that in the second part. Usually, burnout always starts with sleep problems. That's why when you have sleep problems, it's really essential to start acting. It's not a luxury, it's one of the big pillars of health. Lack of sleep increases obesity, it kills the immune system, it prevents melatonin secretion. Melatonin is very important for neuroprotection, that your brain keeps healthy until old age. And for prostate cancer, it quadruples your risk for advanced prostate cancer, and it does that with a lot of other cancers. And I've seen that very often, especially with early cancer patients, that intense stress played a very big role. So, we are going step by step through the major problems of our time. Like, we have all that stress which builds up with alongside with the belly, high pulse, hypertension, swollen face. No big deal. Gradually, blood sugar rises, triglycerides, the blood fats, they rise. Cholesterol rises over 200. Still no big deal. Yeah, it goes on. Now blood pressure is 160 to 100. No problem. I'm a man, So we are on a very high cortisol production. Men can do that for a lot longer time. That's why they keep expanding a lot longer than women often. We have a cortisol resistance, so we don't react to the cortisol we make so much anymore. And then something happens. It can be, women are more easily affected. It can be an infection, even a simple infection, a trauma. And all of a sudden, we have an acute burnout that's triggered by that infection, because infections use up a lot of cortisol. And when the cortisol drops, we enter into that adrenal fatigue problem. Or it can be a very gradual decline. And it's usually not only the cortisols, but all the other neurotransmitters as well. So once you're hit by like a heavy bronchitis and feel chronically weak, that can go on for weeks and longer. A little cortisol does really wonders in that, but better is to recover and change your lifestyle. This is directly connected with inflammation on a cellular level, because cortisol is there to silence the inflammation we are causing to our system. It's like the fire brigade in our organism. That's why it's the most important long-term stress hormone. The acute inflammation, it hurts. It's pretty harmless. Well, depends on where it hurts. And the chronic one, the low grade, it kills. And it's the basis of most of our lifestyle diseases. It was first discussed 1990 also for arteriosclerosis. It's well established by now. And it's connected really with all the major diseases we have. If you talk about cancer, cardiovascular disease, diabetes, cognitive decline, and Alzheimer, it's all there, connected with silent inflammation. And obviously we know that certain kinds of lifestyle and diets are highly preventive to keep it moderate. That author coined a very interesting phrase. I don't only like the word inflammaging because it speeds up aging, obviously, but it also is garb aging. Now we age through all the garbage, not only what we eat, but which stays in us. So you know that from naturopathy, that slagging, I don't know how you call it in French, nor that build up of all kinds of toxins in the body gradually. That's supposed to be behind all the problems. When you used to say that like 10 years ago to any doctor or professor, he would immediately say, you're a quack. Now it's proven on so many sides that they were the quacks. They were just clueless, like, bacteria in the stomach, nonsense. So many things where school medicine has been terribly wrong and missed out on a major problem. So the enemy comes from within. When we are not only attacked from the outside, but we build up all this half-digested food, molecules, cell debris. When the circle of digestion doesn't go to the end, that's the trigger for a lot of the inflammation we see. And of course, it's connected with the microbiota and so many other factors, but a very important one is the diet. And we've known that actually for a long time, for almost 5,000 years. It's the founder of medicine who said the same thing. The right diet and lifestyles are the most important thing. Fasting purifies body and soul. If you said that 20 years ago to a medical doctor or in France, how's the fasting recognized in Belgium or France medically? It's one of the most important therapies, actually. Now it's getting cool because now autophagy is stimulated. Well, there is garbage in the cell. Well, and you need to digest it, but they don't call it digestion. They call it autophagy. You need a cool name for it, and then it becomes again, you can talk about it, but before you're a quack. So he said all these interesting things you can read here. He also, the problem is not a new one. Feasting and inertia has been a problem for millennia also. And his diet was also amazingly simple, and it worked to create enough fame to stay for 5,000 years. Purely vegetarian diet, lots of exercise and fresh air and sun, and deep sleep. They had these temples where they basically put people to sleep. He'll sleep. But we can make it complicated again. That's when you look at from the modern perspective, we can go all the cytokines and all the different crosstalks which there are. But in terms of therapy, we won't really get much better. And usually doctors just get more confused. Although I like cool pictures, this one is really cool, but it lacks one major point, which all this inflammation talk usually lacks, which is how it starts. It's considered a very harmless, even though dramatic molecule, histamine. Histamine intolerance is the most underdiagnosed and widespread condition we have in Western societies. And it causes symptoms which are so broad and unspecific that usually doctors who spend 5 to 7 minutes with their patients have no understanding. So the patients, which are like 50 to 70% of the chronically ill, they have a pilgrimage from doctor to doctor, and maybe after the 20th, they have a diagnosis. And their life changes, and they do one thing and it changes dramatically. We come to that a little more. So again, histamine, there it's where it starts actually, and it draws all the other more chronic inflammatory cytokines to the place of action. On the cellular level, deep down, we have NF-kappa B activation. So this is what is switched on long term when you have chronic stress, chronic problems, chronic toxins, chronic obesity. Body switches on NF-kappa B, and then you get the whole gang of inflammatory and cancerogenic genes switched on and active in order to keep you alive, basically. It's all anti-apoptotic so that you don't die. Inflammation cascade is started. So that's a very important point, and we can counteract this by plants, especially like pomegranate or curcumin, lifestyle, and as it plays a very important role in cancer, we talk about cancer now. Yeah, we're doing quite good. Should I speed up, or is it okay? So the first one is obvious, but nowadays people don't smoke. They get brain cancer instead with their mobile phones. And the number 2 is prostate and breast cancer, getting more and more frequent. And with prostate cancer, we really can do a lot to prevent it and not to have it. And this one is also, can be taken care of by diet a lot. So the 3 main cancers can be influenced by us dramatically.